Now, questions on the topic of libido naturally lead us to Professor Sheryl Kingsberg in the US. Professor Kingsberg, we have a question from Robin in Tasmania. Robin asks, are there things that a woman can do to help boost her libido before going to talk to her doctor about treatment?
Well, when we think about libido, think about spontaneous appetite, which is, to put it simply, feeling horny, right? It's your spontaneous interest, having appetite. And then there's responsive desire, which is you may not have as much of that appetite that you had, but if you don't overinterpret that, if you don't, if you're not constantly distracted by why don't I? And you can enjoy sort of the process and enjoy responsive desire. That's also a way to kind of shift your mindset about being sexual. For example, women in long-term relationships very rarely have that spontaneous passion at the mere sight of their partner, right? If you've been with somebody for 20, 25 years, it's hard to kind of get that, oh my goodness, I can't wait to get you into bed feeling. Sometimes you can, but on a daily basis, that's a little harder than if you were in a new relationship. So it's really actually the age of the relationship and not the age of the person in the relationship that makes a difference about that, right? If you're 65 and in a new relationship, you're going to have that passion. But if you are 45 and in a long-term relationship, it's a little bit more challenging. So one way is to recognize that, and you have to put your own spontaneity into it to, change things up a little, be a little bit more playful and innovative and novel, and that can be helpful. Not overinterpreting the fact that, after a long day's work and you've seen your partner every day for 20 years, that's not going to be an easy fix to sensuality. Certainly good health and exercise. We know actually that taking good care of your body with exercise can actually improve arousal, and that can also help with desire.